Hello, class. Now we're going to the other form of organizations that help to address the health of the community, the nation, and also help with some global health. Usually it's called the quasi-governmental health organization. Quasi-governmental health organization. The word quasi here means it's part government, it's part private. And most of the time, the naming is usually based on who is really doing the funding. Remember when we dealt with the government agency, the government organization, the Department of Human Health Services, they get all their fundings from government to address the health needs of the citizens of America. Unlike the quasi-governmental organizations, they get some of their funding from government, but they also get some of it from private institutions, from individuals, from contributions, and from also from foundations. So slightly different, but with the same goal. And most of the time, they are, to a great extent, they operate independent of government supervision. It's usually, even though they get some funding from government, but in a way, it's almost privately run. So, quasi governmental health organizations. These are some of the characteristics of quasi governmental health organizations. Some official health responsibilities. They operate more like voluntary health organizations. People who are interested, people who give their time. And in some cases, you have some people who work in those places that are not paid. They just do it because they want to help. Operate independently of government supervision. They have their own supervisory system to making sure that, okay, what they said, the money that they have, they're using it the right way and using it for the right purpose, and also set priorities. So the money is used based on the priorities that they have set. The funding is derived from the funding is derived some funding and work from government. So some of it is from the some of it. Now examples. You have the American Red Cross. Is there an example of a quasi-governmental health organization? The American Red Cross, the National Academy of Sciences, and National Science Foundations. And if you see whenever there are issues, the American Red Cross is always there to provide health relief whenever there is a disaster. They will be one of those organizations that will be there to help. Then you have the National Academy of Sciences. Again, they help with grants, with research activities geared to us addressing the health of the country, and also using different disciplines, because the National Academy of Sciences, most of the time, some of the sciences are also some social sciences. Because as you can see, when it comes to dealing with the human being, the pure science alone, the natural sciences alone is not enough to address health related, the human behavior, the health related issues facing humanity. So the humanities are also, the social sciences are also involved. Then you have the National Science Foundation. All of those contribute to investigate issues that affect society and come up with ways as to how best to address some of those things. Now, you have the American Red Cross. Its official duty is to provide relief to victims of natural disasters. Whenever there is a disaster, a hurricane, earthquake, tornadoes, you name it, fires, you will see there somebody from from the American Red Cross. They are always there to provide assistance. And this assistance can vary from medical to food up to shelter, providing shelter for people that have been displaced or people that have been hurt by the disaster. Serves as a liaison between members of armed forces and their families during emergencies. So they go between, because most of the time when there is a disaster or an emergency, there's always so many agencies marshaled to go to some of those areas with disasters. So the Red Cross act as a go-between members of the armed forces, police, military, and their families during an emergency. Then you have the non-governmental services. See, you have the governmental, the quasi, now we have the non-governmental services. Now, most of the time, again, some of those non-governmental services involved, and the Red Cross is very big on that. Blood drives, making sure that there's enough blood supply in case of an emergency. There's enough blood supply of various types so that blood fusion can be done when people have lost blood, and to keep them alive, they need blood. You have safety services, community volunteer services, and international services. Because most of the time, the Red Cross does not only stop in America, they go beyond to provide services to help people that are in pain, to help people that have lost everything due to disasters. Now, the part of international movement, they are also part of the international movement. Now, the American Red Cross was founded by a lady. The American Red Cross was founded by Clara Barton in 1881. There was a situation wherein people were bleeding during wars and this, and she saw the need to provide assistance. And from one person, now you have an organization that is so helpful to so many people. It goes to, at times, most of the time, people think, oh, I cannot do this. Well, she was just one lady who started this whole thing that has become a real saving. Whenever there is a disaster or an emergency, just look around. Even at times when there are fires in homes, people lose their home. Who are the people who go there? The first people, the American Red Cross. They go there to provide assistance, provide shelter for those people who have been displaced because of the emergency. They've lost their homes. They've lost all that they have. The American Society, the American Red Cross will try as best as possible to provide assistance. So the American Red Cross was founded by a lady named Clara Burton in the year 1881. So whenever you see the Red Cross, and it's, just think about it was started by one lady who saw the need and went to work. Everybody has the possibility to make a difference. It's only, are you the one to be the next savior of certain things? Are you the one that is going to provide assistance for so many other people? Don't think that is kind of, some people are destined. Most of the time, nobody is destined for. It's just your willingness to do it. Take advantage of opportunities. Okay, then you have the non-governmental health agencies. They are funded by private organizations. And these private organizations, to a greater extent, they are funded by private donations or memberships do, because some people belong to certain organizations that are non-governmental, and they get their fundings and their the resources that they need through private donations and through membership dues. Across dues to unmet health needs, they they arouse or raise funds to meet those health needs that people might have, to assist. Operate free from governmental interference. It's purely private, and they do it without any governmental interference. Meet specific IRS, the Internal Revenue Services guidelines with tax status. Most of the time, some of these non-governmental organizations, depending on, they have some breaks when it comes to taxes, because they provide assistance for people who need help. Now, there are many types of non-governmental agencies, An example, you have some of these voluntary organizations. Some of them can be voluntary. Some of them are professional. Some are religious organizations. Some are social organizations. You have philanthropic and corporate service. So even though the government provides a lot of assistance, but the government alone is not able to provide all assistance to all people at various communities. So the non-governmental health agencies usually they come in to assist, especially in some of those rural areas wherein it's difficult to reach. And religious organizations do a good job of it in trying to help. You have the voluntary health agencies. They are created by one or more concerned citizens. These voluntary agencies or health agencies created by one or more concerned citizens that felt the need, or felt a specific health need was not being met by governmental agencies. See, this voluntary organization, they only help the government wherever the government stops or have difficulty addressing, they come in to address, making sure that more people receive help when they are faced with challenges. Most exist at national, state, and local levels. National often focus on research. State link national with local offices. Local often carry out programming. So you see, the focus of some of these voluntary organizations is mainly on research. What are the issues? Investigate the problems. And once the information, they know what is there, what are some of the issues, what are the barriers or the challenges, or what are some of those factors, they share that with the state. And the state share that information at local offices. And at the local offices, programs are carried out. Usually the people in the voluntary health agencies, usually there are a combination of paid staff and volunteers. The purpose of voluntary health agencies: 4 basic objectives. They raise money to fund programs and or research. Now, depending on certain diseases or certain conditions, you have voluntary organizations. You have voluntary organizations for cancer, for breast cancer, Alzheimer's, for kids with challenges. So they raise money to fund programs and also research, provide education to professional and the public. They provide education since they do the research and find out some of those, what are the root causes or what needs to be done. They share that information with professionals and the public. They provide services to those affected. And yes, they perform the role of advocacy, be their mouthpiece, raise their concerns to higher ups, to legislators, to politicians, to all those people that can listen, that can be of assistance, and also to the wider public. Some people with means, because some people with means don't know that there are certain people with real challenges. And one thing about really contributing to this voluntary organization, you don't have to have so much money. Just give. You can give your time, and also you can give your material depending on what they're asking for, and you can give money. So there are a lot of these voluntary health organizations around communities. Look around and see where you can start. Because to be somebody in the public health or health related fields, I think a good start is volunteer. See what really goes on. See how things are, how certain programs are developed, and see how people can really be committed to accomplishing goals. And also see the ups and downs. Because when it comes to developing programs for even the underserved or people in need, it's not always a straight line. But you always be willing to give your time, learn more, see what was right, see what was done poorly, go the next time, learning from past mistakes or past omissions to keep working to improve the quality of health for the people that you want to help. Fundraising is a primary activity because there's never enough funds to deal with human needs, because disasters always happen, challenges always happen, diseases always happen. And so, since they always happen, there's always need for money. And at times, you have to be able to help when possible. But don't reduce your desire to volunteer because you don't have money. Try to find out, try to find out what are some of the issues, what are some of the concerns. See how you can volunteer either your time. You see, because most of the time it's not only the money, but your time is also very important. Now you have the ACS, the American Cancer Society, the American Health Association, March of Dimes, and the MADA. So, okay, you can read this. The American Cancer Society is one of the biggest and always need money to develop programs education, service, and research, and also advocacy, because a lot of people succumb to this disease. And what people need to do, provide education, make sure that, no family history, and take the necessary steps to prevent cancer. Early detection can go a long way in helping your recovery. See, even though there's a lot of innovation today, but cancer still remains one of those challenges that in most cases takes lives. So know your family history. Know those things, that what are the risk factors and what can you do to help reduce the ravages of cancer. Then you have professional organizations. Now, these professional organizations is made up of health professionals who have completed specialized training and have met standards of registration, certifications, licensure for their field. So more or less, these are the top in these are the people that are really the cream of their profession. That's why they are called professional. And these are those people who they spend the time to educate themselves, to make sure that they have all the necessary registration, they've met all the necessary registration, and one of their biggest is to promote high standards for professional practice. You see, because when you promote high standards for professional practice, most of the time it reduces suffering, it reduces malpractice, and also it increases the people who are the gatekeepers. Because any profession, if you don't have gatekeepers, you cannot just allow everybody to call themselves as part of the profession. You cannot become a medical doctor without the proper training, without the proper certification. You cannot become a heart surgeon without the proper training. Because if you without the proper training, you cannot just try to promote health related issues by guessing. You have to know what you're doing, because you're dealing with lives. And you don't want to. One thing about professionals in health is they don't want to do harm. And not to do harm means you know what you are doing. You're observing the laid out standards of practice. There are times, even with all this layout, things can go wrong because we are human beings. But at the same time, it should not be common practice. So the professional health organizations are there to maintain standard, the quality of practice. Most of the time, those are funded primarily by membership dues. Now, example, you have the American Medical Association. See, everybody within the medical and within the medical field has to make sure that you meet the standards, the expectations, the type of practice that is laid out by the American Medical Association. Any violation of those standards, your license could be revoked and in some cases thrown in jail. Because there is a code of ethics. Each professional organizations have a code of ethics, a code of conduct, the things that you are allowed to do and the things that you are not allowed to do. If you remember, there was a time wherein a gymnastic coach in, I think, Michigan was abusing some of the girls that he was supposed to help. And now he's in jail because of it. And you can think of so many of those. Then you have the American Public Health Association, which also supervises or monitor or come up with standards that are expected. Because for you to become a public health practitioner, you have to meet those standards. You have to have that body of knowledge. You have to have the skills. And yes, there's a code of conduct, code of ethics. Then you have the philanthropic foundations. You have people who are philanthropic. They want to help others. They want to share their blessings with others. And some of these philanthropic organizations or foundations, endowed institutions that donate money for the good of mankind. They help institutions to develop certain things so that they can help other people who are suffering. They fund programs and research on prevention, how to prevent certain diseases, how to control the spread of certain diseases, and the treatment of many diseases. You see, first of all, you prevent. But when prevention fails, try to control the spread. And in the process, also provide treatment of those with the disease. See, even right now, why do we have to wear the mask? Part of it is to prevent, so that if somebody has it, that person cannot pass it to somebody else. So if we all wear a mask, we help ourselves as well as we help those around us. And at the same time, that also helps to control the spread. We wash our hands, we keep 6 feet distance, and we avoid being in crowded places. And now there are some form of treatment that have been proven to be helpful. Again, that's also part of the process. And yes, you have some philanthropic foundations that are helping out in some of these situations. It's not only the government. The government is carrying most of the weight, but you have some philanthropic foundations that are also helping out. Some have board support, others very specific. Some don't have any broad support. Very specific, very basic. Now, example, you have the Bill Gates and Melinda Gates Foundation, which has done a lot of things to help improve health, especially in sub-Saharan Africa. Then you have the Commonwealth funds. Most of the time, some of those funds are used for educational and other. Then you have the Robert Wood Johnson Foundation, and you have the local community foundations. See, these are all philanthropic organizations that uses their resources to improve the life of mankind through health, through education, through other services. Service, social, and religious organizations. Many do not have health as primary mission. So some of these services, social and religious organizations. Some do not have health as their primary. But again, when you provide education for people, you provide other, even though it's not really so-called health, but you help the person in certain ways, because an educated person can be able to read, to look for information, to investigate things that they can use to improve their health. Even though the services were provided for education, but again, an educated person has the opportunity to use that resources to deal with their health-related issues. They have the contributions. Example, the Kwanas, the elk, the Shriners, Lions, and FOP. These are all various organizations. Contributions of religious groups to community health are substantial. See, religious groups contribute, as I said, to community health are substantial. Then you have the history of volunteerism, the influence on families. Some of them donate of space, they give their land or offer their space for certain programs to be run or certain activities to be run, sponsorship for programs. Now you have the food banks and shelters. Especially now, there are so many places wherein there is a food desert because of the COVID. People lost their jobs. They cannot afford money to buy food, so they rely on food banks. And these are all social services that members of the community, through volunteer, through donations, help others in their community that are faced with needs. These are all examples of some of those groups. See, community service groups contribute needed resources for the improvement of the health of the community. Then you have the discussions, questions. Now, one of the please take time to really understand some of these discussion questions because they can help you along the way. How have voluntary health organizations impacted health outcomes? Everything being normal, I can say a lot. They have greatly impacted the health of people in respective communities because it takes a lot to provide services to so many people. Government alone cannot do it. It takes members within the community to help, to pitch in, to see what they can do for their fellow brothers and sisters. Now, how does the Department of Health and Human Services impact individuals? First of all, their main responsibility is to prevent, promote, and provide health services for their communities. Prevent diseases, promote quality of health, and provide necessary resources to help those communities. Now, how can the World Health Organization overcome the obstacles they face? Now, most of the time, some of the obstacles that they face is mainly as when you're dealing with a big organization, you at times you need a lot of resources, you need funding. And member states should be able, especially the Western countries, should be able to provide those fundings because they can do as much as they have the funds to do. When the money runs out, then, and most of the time, each member nation should also be able to, whenever there is a disease or whatever they experience, get in touch with the United and the World Health Organization immediately so that expertise can go there to further investigate and find a way to prevent it. And at times also dealing with cultures. Some cultures are hard to deal with because of their cultural beliefs. Dealing with Western medicine or Western ideas most of the time can be a challenge. So it's to find ways to deal with this cultural, break down some of these cultural barriers, increase the funding, and also increase the research, make the reporting of information streamlined. You see, because right now people are having issues even with this coronavirus that the World Health Organization did not get the relevant information on time to put together the sort of plan and plan of action as to how to combat this virus. So obstacles can be of many shades. But the biggest is the commitment for organizations to continue to support the project that the health organizations develop, the resources that is needed to develop those programs. Okay, you have a nice one. Again, as I always say, please read the textbook. If you have questions, please get in touch with me either by email or just call my phone. You have my number, or text me, because my desire is for you to understand this content and, where possible, use it to improve your health and the health of your community and the health of your family. You take care. Bye-bye.